The hamstring strain is a very common sports injury. It can happen in all sports at any level. It is a devastating injury that can be season-ending. It is also devastating the fact that psychologically it can be very tough to overcome because it is such a severe injury, and it also is an injury with a very high recurrence rate. The hamstrings are a very long, thick, and powerful muscle group. The term hamstring describes 3 separate muscles. These muscles all work together. One muscle has 2 heads, a long head and a short head. All 3 of the muscles originate in the lower part of the pelvis on what's called the ischial tuberosity. The ischial tuberosity is sometimes nicknamed the sits bone because that's the bone that you feel when we're sitting. The muscle on the outside of the leg, the biceps femoris, is the one with the 2 heads. The long head starts at the ischial tuberosity and runs all the way down, attaches right down here on the outside of the lower leg on the fibula. The shorter head starts right here and joins with the long head and attaches over here. The 2 other muscles, the semimembranosus is the muscle on the medial or the inside of the back of the thigh, and the semitendinosus is the muscle that is in the middle. It comes down, wraps around, and it actually attaches to the very front part of the lower leg in an area called the pes anserine. These muscles are very strong and very powerful. When you think of the hamstrings, most people think that the hamstrings flex the knee so that you're bending the knee backwards. But the hamstrings do a lot more than that. In what is called a concentric contraction or the positive contraction, the hamstrings bend the hip backwards and flex the knee. You should think about where the hamstrings start, right up in here, where they attach at, all the way down here. They cross 2 major joints. They cross the hip joint and they cross the knee joint. So there's going to be motion at both of those areas. So a concentric contraction of the hamstrings pulls the hip backwards and bends the knee. Basically, it is pulling the heel back towards the butt. That is what the concentric contraction of the hamstrings does. The hamstrings also assist in rotation of the thigh and rotation of the lower leg. When the hip is straight, it assists in turning of the thigh. When the knee is bent, the hamstrings assist in rotation of the lower leg. One of the main functions of the hamstring is how it contracts in the eccentric or in the negative fashion. Very important to know this because this is going to be very important when we're talking about the mechanism of injury and also in the rehabilitation and the prevention of an injury. The hamstrings contract in eccentric fashion to control the forward motion of the thigh and the lower leg. So you think about what the hamstrings do when they are contracting in the positive fashion. They're pulling the hip and the thigh backwards. So when we are walking or when we're running, the thigh moves forward, the lower leg moves forward because we're contracting the hip flexors and the quadriceps, and the hamstrings are the opposing muscles to that motion. So the hamstrings work very hard to control the motion of the lower leg, especially if we are sprinting, if we're running uphill, if we're jumping. The hamstrings work exceptionally hard in the eccentric fashion. So you have to think about that. Then also we spoke about how those muscles attach. So what the hamstrings also do is that they help to provide stability to the knee joint. Is the semitendinosus comes all the way down and attaches here. So it helps to provide some stability to the medial aspect of the knee. And also the hamstrings are very important with the ACL or the anterior cruciate ligament because the hamstrings help to control forward motion of the lower leg. So having strong, powerful hamstrings is very important in the prevention and the rehabilitation of a knee injury when we're talking about the ligaments, especially in the medial aspect or with the anterior cruciate ligament. The hamstrings have multiple functions. We want to make sure that our hamstrings are very strong and very flexible to help prevent injuries and to get them functioning as well as we can so we can perform at 100%. A fascinating fact about the function of the hamstrings is that the hamstrings work in all three planes. They control the forward motion of the leg. When they contract concentrically, they are moving the leg straight backwards, so that's one plane. The second plane is the side-to-side plane. They help to stabilize the knee joint, so they function in that plane. And then the third plane is the rotational plane or the transverse plane, this right here. Remember we talked about when the hip is straight, the hamstrings help to rotate the thigh, and when the knee is bent, the hamstrings assist in rotating the lower leg. So therefore the hamstrings work in all three planes. The mechanism of injury of a hamstring strain can be either traumatic or it can be a slow, insidious onset. When it is that insidious onset, in most cases the cause is overtraining. Overtraining is doing too much too soon, not giving your body adequate rest between your training sessions, and not providing your body the nutrients that it needs to recover from your training sessions. When a hamstring strain is that traumatic fashion, oh, it's difficult to watch. It really is. I mean, it's difficult to even speak about. In most cases, the athlete is either sprinting, maybe sprinting uphill, accelerating, decelerating, or changing direction, what we call cutting. And that is when the traumatic hamstring strain occurs. In most cases, it's going to be so painful. The athlete may hear or feel a pop, doesn't have to, but the pain comes on immediately. They'll reach down, grab their leg. If it's severe, they may even hit the ground. They may grab it and just hop off using the opposite leg, where they're not going to want to use this leg at all, use the injured leg at all. The traumatic hamstring strain usually occurs when the leg is in full hip flexion and full knee extension. The leg is all the way forward, the hamstrings are stretched out a great deal, they are being contracted eccentrically, and then all of a sudden they have to contract concentrically to start to pull the leg backwards. That is usually the point where the traumatic hamstring strain occurs. Multiple contributing factors exist for a hamstring strain. The intrinsic factors of a hamstring strain are numerous, but there are several that are key, that are more important. Those are a strength imbalance between the muscles in the front of the thigh and the hamstrings. When someone is what is called quad dominant, it means that their hip flexors and their quadriceps are stronger than the muscles in the back of the leg, stronger than those hamstrings. So that creates an issue because it causes the hamstring to be in a stretched position and it has to work extra hard, so a greater demand is being placed on it when it is contracting concentrically. Another key contributing factor is weakness in the core muscles. The core muscles include the rectus abdominis, the oblique muscles, the lumbar spine muscles, the gluteal muscles, the pelvic floor muscles, and the medial thigh. If any of those muscles are weak, it causes the pelvis and the lower spine to be unstable. When the pelvis is unstable, it can put the hamstring in a stretched position and make it more susceptible to an injury. Another key factor that is an intrinsic source of a hamstring strain is tightness in the hamstrings. If those hamstrings lack flexibility, if they are constantly on tension, constantly have tension in them, it creates an issue where those muscles just cannot move the way that they should and makes the athlete more susceptible to the hamstring strain. Contributing factors to a hamstring strain can also be extrinsic, meaning they could be from outside the body, things that we are doing in our everyday life and in our training. One of the key elements is overtraining. When we overtrain any type of muscle, we make it susceptible to injury. We are not letting the body recover from our workouts or from our competition. We are not resting properly, and the next time we go out and train, the muscle is still fatigued, and that sets it up for the injury. Prevention is the $1 million ticket. If you can prevent an injury before it occurs, that is fantastic. That will help you so much. Injury prevention is easier, less expensive, and much faster than injury rehabilitation. When I say that, people laugh. They think, of course. Why do I always repeat that? Because it's so important. So do everything that you can to try to prevent the hamstring strain. First of all, eliminate the extrinsic factors by having a good training routine and allow your body adequate rest between training sessions. Allow yourself time to recover from your workouts and allow your body to function the way that it should by giving it the rest it needs and by giving it the fuel that it needs with proper nutrition. And then when we talk about the intrinsic factors, how do we eliminate the intrinsic factors? We spoke about a strength imbalance where the quadriceps are stronger than the hamstrings. I spoke about weakness in the core and then inflexible hamstrings. So we want to stretch the hamstrings. We want to make those muscles more flexible. We want to strengthen the hamstrings with a variety of exercises. And we want to strengthen our core. There are numerous exercises that you can do to strengthen your core. They can be stability exercises, they can be motion exercises, or a combination of both of those is what works best. Prevent this injury with good training and by eliminating the intrinsic and the extrinsic factors. If an injury to the hamstrings does occur, you want to take action immediately. Do not hesitate. If it is a traumatic type of an injury, you will need to take action immediately. If it is the insidious onset, it is something where you do not want to delay. And I've seen people delay this and it drives me crazy and it ends up taking them much longer to recover. There's so many things that you can do, but you want to think about stretching, foam rolling. If you can perform motion exercises, always work through a pain-free range of motion. Once you get farther down the line, you can do strengthening exercises. All these things add up. Whatever exercise that you can do, say you cannot get out and run, but you can ride a stationary bike, do it very moderately, but it's going to help a great deal because it's still going to bring motion to all of the joints that the hamstrings are associated with. So what you want to do is use common sense, start your treatment immediately. If you need to apply ice, go ahead in the very beginning. Always make sure that you have a thin towel or a washcloth between the ice pack and the skin. Use the ice for about 15 minutes and then go ahead and take it off. Like I mentioned before, the stretching exercises. You always want to be very careful when you do stretching exercises. Stretching should be very, very mild. Foam rolling, same thing. You don't need a large amount of pressure. Very, very mild. Make sure that you hit all the different muscles in the hamstrings. I will post a playlist after this video where I am going over strengthening exercises and stretching exercises and foam rolling exercises for the hamstrings. Believe me, if I put them in this video would be incredibly long. There's also going to be videos where it is stretching the quadriceps and stretching the hamstrings and doing foam rolling, the hip flexors and foam rolling those areas because that is so important in helping to eliminate the strength imbalance that occurs between the muscles in the front and the muscles in the back. Take action immediately. Do not hesitate. See a doctor of chiropractic. Chiropractic Care can help a great deal with a hamstring injury. Chiropractic Care for a hamstring strain will do 3 very important things. First of all, it's going to optimize the nerve flow coming from the spine going into the hamstrings. The hamstrings are innervated, meaning that their nerve flow comes from the lower part of the spine, down in the lumbar spine. So we want to make sure that that area is functioning properly, so the proper nerve flow is going to those muscles and coming back from those muscles into the spine. The next thing it's going to do is it's going to restore proper skeletal motion. If there is a misalignment in the hip or in the pelvis or the lumbar spine and the knee, that is going to affect the hamstring rehabilitation. The chiropractic adjustment helps to restore proper skeletal motion. When we have proper skeletal motion, that optimizes the nerve flow, which is what I already spoke about. But with proper skeletal motion in the lumbar spine, in the pelvis, in the hip, and with the knee, and even in the ankle and foot, that helps a great deal with hamstring injury prevention and hamstring injury recovery. When everything is moving properly and functioning properly, only the correct amount of stress is being put on those hamstring muscles, and it's going to allow everything to be in its proper position, and the correct demand will be placed on those muscles. Therefore, they won't be getting too much stress put on them, and they will be able to recover properly. Then the third thing that you will learn at the Doctor of Chiropractic is what is called patient education. I'm a big advocate of patient education. I like to teach patients things that they can do outside of the office: stretching, strengthening, foam rolling, ergonomics, nutrition, all types of things like that. You are going to learn a great deal at the Doctor of Chiropractic office. Ask questions. If you have questions for me, please feel free to ask. It will help you a great deal because you will be doing things correctly outside of the office to help yourself to prevent and recover from the hamstring strain. If you have suffered hamstring strain, the return to activity is going to depend on how severe that hamstring strain was. That's only common sense. You want to start very, very mild, whatever activity that you want to do. First of all, you have to make sure that you have rehabbed your injury. You want to make sure you've done your stretching, your foam rolling, your strengthening, you strengthened your core, you strengthened your hamstrings, you stretched all the muscles that need to be stretched. That is going to help you a great deal. And then when you get back to your activity, start very mild. Don't try to start at the point you were at when the injury occurred. Start at the level you are at right now. That is a key factor. And once you start, give your body ample time to recover from these training sessions. You may have to start at the very bottom with just walking, okay? And that doesn't matter because at least you're starting and at least you're able to do something. And then gradually build up in very small increments. Very small increments, you increase the intensity of your training. And throughout that time, you pay very good attention to how your hamstring is feeling. Your recovery from a hamstring injury should be very thorough, very comprehensive. That is going to help to prevent a recurrence of the hamstring strain. In conclusion, the hamstring strain is a common injury that many athletes suffer. It is preventable, and it is manageable, and it is something that athletes have recovered from very successfully. Do everything you can to prevent these injuries by eliminating the contributing factors. Eliminate the extrinsic factors and the intrinsic factors. Strengthen your hamstrings. Stretch your hamstrings. Foam roll your hamstrings. Stretch the quadriceps. Stretch the hip flexors. Foam roll the quadriceps and the hip flexors. Strengthen your core muscles. Not just your rectus abdominis, but everything. Your gluteal muscles, very important that the gluteal muscles are very strong in the prevention of a hamstring strain. We want to make sure that our core is as strong as possible. When we talk about rehabilitation, when we talk about recovery of a hamstring strain, again, do everything that you can. And I know I mentioned this before, but you want your recovery to be as comprehensive as possible. Not only do you want to prevent a reoccurrence, but you want to be able to compete at your highest capabilities. Take it slow. You will do just fine if you listen to your body and you increase in very, very small increments. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Wishing you health, happiness, and fitness. Prevent injuries, stay injury-free, have fun with your training. Prevent these hamstring strains, recover from a hamstring strain. This is Dr. Donald Ozello. Train smart, train hard, stay injury-free, and accomplish your goals.